retroactive fashion. There's usually a clinical incident or there's a near miss, and we have to evaluate what happened, and often then is when we're assessing those social barriers and we're actually identifying and determining what they are. And the hope is that instead of doing it in that direction, that we will actually just consider them and start thinking around that in a preventative fashion to determine what are those potential social barriers and how do we address them before there's an incident.
Can you give me some examples of some social barriers that you've encountered in your clinic?
So some of the social barriers are around access for some of our clientele. If transportation is an issue and they have a 2 o'clock appointment and their transportation gets them to the clinic at 2:30, how do we designate these individuals who have those social barriers and accommodate for that? So what we've done as a clinic is we've identified specific patients who we believe have those challenges or who have volunteered the information that they have those challenges, and just designated them in the EMR so that there's an awareness of the front staff that they may need a little extra time or they may be late for their appointment, so that there's no scheduling issues and we can accommodate. A fair number of patients in our clinic who have a language barrier. They're new to Canada and they have a number of languages that we don't have translators for, and so it becomes challenging. Again, we rely on our communication skills that we've been taught as family physicians in our training, summarizing, reaching common ground, ensuring that there's that understanding. When it's an actual language barrier, we've resorted to apps. A lot of patients will bring in their own devices or apps on their phone that will convert the written word and even the audio word. We've used that. We also have a training program, and we've had Mandarin speaking residents and Russian speaking, and we do have a lady in our office who speaks Cree.
Do you know if your patients can afford the medications you prescribe?
Always. That's part of training as a family physician, and we are an academic site, and so we're very sure that we teach our residents and all of our physicians are on board with this as well, that we understand the context, the social context of our patients, and it's very important about treating. Ensuring that they can afford the medication that they've been prescribed is very simple. We have a very collaborative arrangement with our pharmacists in the community, and it's as simple as picking up the phone and saying, I haven't prescribed this medication before, can you give me an idea of what this is going to cost the patient? And then reaching that common ground with the patient to determine, is this something that you can afford? Is this agreeable to you? And setting your plan that way.
And do you do something if the patient can't afford a medication?
There's often a number of workarounds, and so the other side of the formula for ensuring patients get the medications that they need and that they can afford is a time factor. So we are contracted in our group, so you spend the time that's necessary, because sometimes there is a bit of coordination that needs to take place. We do have a clinical pharmacist as part of our team. She's not there every day, but she's available through electronic communication, and so it's asynchronous communication, but for sure she's going to help us determine what our next best option is, how we go about getting exceptional drug status or supplementation for patients.